Hey YouTube. Hey Instagram. Hello everyone. Okay, I think we're live. All right. We're talking about pharmacology tips today. Who's excited? And always a good time when Matthew's not here because you know me in technology. It doesn't work very well. Anyway, I'm going to give you all the good pharmacology tips and perhaps a few tech issues as well. Hello everyone. Tell me where you are tuning in from this evening. First thing I want to say, okay? So Matthew and I do this live show every Monday. We've been doing the live nursing school show this is like year 3, which is awesome. We are actually, y'all are going to be really excited about this. We're actually going back to doing it on Mondays and Wednesdays in the morning, okay? It's too much for us with the children to do it at night because very rarely are they all in bed at the same time. So we're going to do it in the morning. And so on Wednesday, Matthew and I will be live at 7 a.m. Pacific, 10 a.m. Eastern. And we're going to go back to an Ask Me Anything format. So exciting. So you guys can just jump on Mondays and Wednesdays, ask me nursing school questions. Let's go. It's going to be awesome. Today in this video, though, we're going to talk about pharm. And it's going to be awesome. I have so many pharmacology tips for you. We're going to have a lot of fun. Hi, Michigan. Hi, Australia, Nebraska, Jersey City. How you doing, my friend? Denise, love it. Queen Carol, hello. It will be our new AMAs are going to be at 7 Pacific, 10 Eastern. Hope I got those time zones correct, but definitely 7 in the morning Pacific, 10 because it's 3 hours, right? Christina and time zones. Y'all know that's an issue. Hi, Texas, Los Angeles. Let's see. I missed it. China! Wow, China! Hello! I actually don't know if we've ever had anybody from China on. You might be the first. Exciting. Georgia, Trinidad, hello. Ghana, Philippines, represent. Okay, well, I am not Filipino, but Matthew is, as you all know, and he always gets very excited when we have the Filipinos on. Ohio. Yay, you're going to be able to join at 7 a.m. So, yes, okay, who was around like a year and a half, 2 years ago when we were doing our lives in the morning? Raise your hand. Were you here? We do it on YouTube and Instagram. We used to do it on Facebook. I don't think we're going to do Facebook anymore because there's a lot of phones involved with this, and I don't need all that tech set up, to be honest with you. London, Miami, hello. Fabulous. You have a pharm exam on Friday. Oh, my friend, do you want to stick around for this? We're going to go through all the pharm tips. It's going to be awesome. Did I see Buffalo? Nigeria. Hello. New York. Canada. Represent. India. Hello. Thailand. Cool. Nigeria. Wow. That is so cool. You guys are from all over the world. I love it. Louisiana. Hello, Kayla. Nice to see you. Rhode Island. Love it. Munich, Germany. Wow. So many wonderful places. Vancouver, which one? I know there's a few. Virginia, Jamaica. Hello, I'm so excited. Okay, friends, the first thing that I want to say about pharmacology is that you're making it more complicated than it needs to be. Let's just throw it out there. When most of us study pharmacology in nursing school, like when you start pharmacology, just when you start nursing school, you want to know everything about everything, right? You want to know all the things about all the things. That's not how to pass your exams. There's no way that you're going to know everything about everything in nursing school. Not possible, okay? So we have to pick and choose what we study, right? We cannot just go into nursing school. Do you see these textbooks behind me? I don't know, Instagram. Maybe they're covered in Post-it notes right now. They're covered with our member names. Shout out to all you guys. All of our members that just joined the Nursing Access membership community a couple weeks ago. You guys rock. Your name's up there if you joined. So, you cannot get to nursing school and expect yourself to know everything in the textbook. Like, if your plan is to go to nursing school and read the entire textbook, you might as well just, like, throw your life out the window. Not helpful for you. Like, you are not going to have a life. You are not going to be able to do anything other than study 24/7 and just be overwhelmed and anxious all the time. Not helpful for you, right? Like, that is not how we do nursing school around here. I want you to actually have a life in nursing school. I want you to actually have time with your children, right? Be able to do things other than study and also pass your exams. That's exactly why we're here. And by the way, you are 100% capable of passing nursing school. If no one told you, I am here to tell you, you are 100% capable of passing nursing school, and I am here to help you make it happen. We're going to make it happen, all right? That's why we're doing this. So, pharmacology in nursing school, you cannot, friends, you cannot expect yourself to know everything about everything about everything. How often do we do this? When you get accepted into nursing school, you just want to know everything in the entire textbook. You cannot memorize the Davis Drug Guide, cover to cover. Not helpful for you. That is not how you're going to pass your pharm exams, okay? So, here's really the key for you. Okay, listen up. I know it's kind of early. I'm going to give you the key right now. You listening? When you study pharmacology, you must break up your medications by class. Do not learn them individually. Okay, did you hear me? Are y'all listening? This is game changing, okay? When you are studying pharmacology, you cannot try to learn your medications individually. It's not going to happen, okay? There are too many of them. There are so many medications that you have to know in nursing school, in your pharmacology class, to memorize all of them. It's just not going to happen. Like I said, if you try to do that, you are going to get burned out, overwhelmed, you're not going to have a life. Not helpful. So what we want to do is break up those medications, group them by class, either pharmacology class or therapeutic class. Okay? Nicole just got a 95 on my first pharm exam from watching your videos. You're awesome, Nicole. That was all you, my friend. I'm so happy to be here and to help. That was fantastic. See, I'm telling you, you are so capable of passing nursing school, you guys. Follow these tips just like Nicole did. You can absolutely do this, all right? So when you group your medications by class, therapeutic class, pharmacologic class, what this will allow you to do is to learn them as a group, literally cutting your study time in half. You guys, it's mind-blowing, okay? How often do you get stuck in trying to learn everything in the Davis Drug Guide just because someone told you you had to know everything in the Davis Drug Guide? Not everything you hear on the internet is true, my friends. If someone tells you to read the entire textbook, do not listen to them. That includes the Davis Drug Guide. Okay? I know I'm being sassy because sassy is who I am sometimes. It's totally fine. Okay? But please, please, please do not waste your time reading everything in the textbook. It's not helpful. Okay? All right. I love it. Thanks for your comments, you guys. That's so fun. So, when you group your medications by class, here's what's going to happen for you. You are going to be able to cut your study time in literally half. And that is not an exaggeration. It is actually, okay, here's how we have it structured inside our Nursing SOS membership community. And you guys, side note on that, if you're a Nursing SOS member, I know a lot of you are. I see you on Instagram. I see you on YouTube, my friends. Thank you. If you are a Nursing SOS member, we have a ton of pharm stuff coming for you over the next, well, it's not too long now. So keep an eye on your emails because, man, this is going to be exciting. We have so many new pharm resources coming for you to help make studying pharm so much easier. So if you're a Nursing SOS member, stay tuned for that, okay? It's absolutely game-changing. So helpful for you. So here is the process for how you're going to study pharm, okay? when you study pharmacology, break your medications up by class. Like I said, pharmacologic or therapeutic class. All right. And then what you're going to do, well, you want to break them up by class, and that's really going to cut your study time in half, because when you group your medications like that, there are so many medications in one class. It's just, it like literally cuts it in half or even a third. So pharmacologic or therapeutic class, okay? Then what you're going to want to do next is study the mechanism of action of the class. So the mechanism of action, it's not super like a fancy thing to study. Like, I know no one's jumping up and down saying, yeah, study the mechanism of action. Like, no one really wants to study the mechanism of action, right? Like, you don't really care about what the medication does in the body, but we have to care, right? As nurses, we have to care, because that is, really what it's doing for our patients, right? That is exactly how the medication is acting in the body, what it's doing for our patients. So the mechanism of action is everything. That is the foundation for everything you have to know about that med, okay? So first step, like I said, break your medications up by class, pharmacologic class or therapeutic class, and then learn the mechanism of action for the class, okay? Not individually. Remember, from now on, can you make a deal with me? From now on, you are not studying medications individually, right? Not happening? Deal? Do we have a deal? Post in the comments. Post in the chat, YouTube. Do we have a deal? Don't study them individually, okay? Don't do it. Don't waste your time. Oh, what is a nursing SOS member? Like a website or something? I'm so glad you asked. That's a funny question. Our nursing SOS membership community is I guess it's a website, you could say, but it's like a whole community. We have a community forum. We have our whole website where you can access, step-by-step nursing lectures. We have basically any topic, that you're going to study in nursing school, we have inside the community. So fundamentals, fluids and electrolytes, pharmacology, all of the medications you need to know about in nursing school, we have them in there for you. So when I talk about like the mechanism of action and knowing the mechanism of action, like our nursing SOS members know that y'all don't need to go and look it up in the Davis Drug Guide, because we tell you exactly what you need to know about the mechanism of action in our farm videos inside the Nursing SOS membership community. So Nursing SOS members got your back. We lay it all out for you. It is all there for you inside our farm course. So yeah, the Nursing SOS membership community is just where, basically, it's your step-by-step guide through nursing school. It's where me, our team of nurses, we come alongside you. We hold your hand through nursing school every step of the way. Like, I know, do you guys see my story on Instagram yesterday? I know that there's a lot of like this talk about, automated things and like chatbots and like AI stuff and not my thing. Like, you guys, seriously, when you get into the Nursing SOS membership community, like, you're gonna get like serious hand holding, okay? Like, you can submit tutor questions to our team. Like, we are here to literally answer your questions. Just before I jumped on this live, actually, Nicole, our lead nurse inside our community, her and I got on a call every Monday night. We have our coaching call every Monday night where you can ask questions, and we're here for you. I mean, it's literally like where we just hold your hand the entire way through. So you're not alone. Like, you can absolutely pass nursing school. We're here to help you make it happen. Like, we're here to make sure that you pass. That's what we do. Yes, there is a wait list. So we do have a VIP wait list. The thing about the wait list, though, is that like when enrollment opens, we don't have a cap. Like, we don't cap it. You can join if you want to join. So like we have, like, you guys, mind blows. So like the last time we opened enrollment, we had hundreds of students join. Like, it just totally blows my mind. Like, God is so good. We really care. Like, you guys, I know that there's a lot of like other programs or other YouTube channels or other stuff like to help you with nursing school. The thing is that the thing that I get stuck on is that a lot of it is like still do it yourself. Like, it's still like, hey, just watch a video and kind of figure it out yourself. Like, that is not what we do. Inside the Nursing SS membership community, we do not let you figure it out yourself. Like, that's not what we do. We are here to literally come alongside you and teach it to you. Like, that's why you're in nursing school, right? You want to learn it, right? You want someone else to teach it to you. So that's exactly what we do. So yes, there is a wait list, but it's not really a wait list. It's just like, you join the list and then I email you when enrollment opens and then you can join. Not a big deal. So yeah, enrollment will open, well, I don't know actually, but it will open again. I just don't have a date for you, okay? So yes, but definitely get on the wait list so that you will be the first to know when it does open. All right, what is after the mechanism of action? Fabulous question, my friend. So the mechanism of action, like I said, is how the medication acts in the body. Now, this is the foundation for everything that you need to know, namely the side effects, the nursing assessments that you have to do, and the nursing considerations that you have to do as a nurse, okay? Nursing student. So when you are studying pharmacology, you really have to know and understand the mechanism of action, what the medication is doing in the body, so that you can understand the side effects that it's causing, the nursing assessments you're going to do for it, and the nursing interventions, nursing considerations that you're going to do, all of that. Yes. You understand? Some meds have different, do you mean effects? Even in the same class. So how do you remember those? Okay, so yes, so Rose, here's the thing. Okay, this is a fabulous question. Yes, sometimes medications will have like a little nuance on them. The one that comes to mind is Lasix and furosemide that cause tinnitus, right? Which is not very common. So there are some medications that do have like weird, they have like their own little kind of thing going on. Sometimes that will happen, Rose. Here's the thing though, that is so important for you to know. When you are studying in nursing school, you do not want to study for the 10% of exam questions that are going to be totally out of nowhere and random. You want to study and focus your study time on the 90% of exam questions, okay, that are going to be really the bulk of the things, like what your instructor talks about in class. How, like, these following these pharmacology principles that I'm talking about. Like, yes, could your instructor pull some random side effect of a medication that you've never even heard of? Of course. But that's going to be really the small minority of exam questions. All right. So, you guys, this is so important. I do not want you to get caught up in like the times on your exams where, yes, you're going to get a question out of left field and your instructor's going to be like, yeah, I tricked them. Hopefully not. But it does happen sometimes where it's just like, sometimes they pull a random exam question up from like page 3032 of your textbook, the footnote, that could totally happen, but it's going to be less common than you think it is, okay? Most often your exam questions, like the 90% of your exam questions are going to be the bulk of what we're talking about, okay? That's what you're going to want to focus on. If you try to focus on that 10% and getting every single exam question right, you are wasting time. And you are not going to do as well on your exam because you have to then jump. You can't just memorize information in nursing school. You have to make the leap to critical thinking. And so, my friends, that is why knowing the mechanism of action is so important, like I said, because once you know how the medication acts in the body, you are able to critically think through those side effects. You're able to critically think through the nursing assessments and the nursing considerations for it. I love using furosemide as an example, and thank you, my friend, Roseanne, because like I said, tinnitus, like furosemide, yeah, sure. And maybe that's one you might want to know, but it's not crucial, right? But for furosemide, right? Furosemide is a diuretic. And so what do diuretics do? Well, they kick out a ton of fluid, a ton of electrolytes from the body. Like, that is what they do. That's the mechanism of action, right? Simple terms. That's the mechanism of action of diuretics, right? They kick out fluid and electrolytes like nobody's business, all right? So from there, knowing that mechanism of action, here's why this is so powerful. from that mechanism of action, what do you think some side effects would be? Okay, and when you think side effects, think of what would happen if the medication works too well. What would happen if this medication just went bananas and worked way too well in the body, like way more than we wanted, way more than we were expecting? So with a diuretic like furosemide, right, it would cause things like dehydration, ding, 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 right? I call it all the hypos, right? Hypokalemia, right? Low potassium, low sodium, hyponatremia, hypomagnesemia, hypocalcemia, all the hypos, right? It's going to kick out fluid and electrolytes from the body like nobody's business. Okay? So once you know, do you see how that's connected? You see how the mechanism of action is then connected to the side effects? This is how you are going to pass pharmacology without completely, ruining your brain in the process and being so tired that you can't even think and like spending all of your time studying. Like that is not helpful for you. Group your medications by pharmacologic class, by therapeutic class, pharmacologic or therapeutic, that's fine. And learn the mechanism of action first. Critically think through everything you need to know about that medication from the place of the mechanism of action. Okay? That's why it's so important. So let's keep going with furosemide. Nursing assessments, like with a medication, a diuretic like furosemide. If you're going to, have a patient on a diuretic, what do you think you might need to assess for? Well, obviously their fluid status, right? We want to be tracking their intake and output. We will probably want to be checking their pulses, seeing, how are they dehydrated? Like skin turgor, right, on the hand. Skin turgor, mucous membranes, are they dehydrated? Check their lab values. How's their potassium level? How's their sodium level? All of these things, right? But it all stems from that mechanism of action. You see? So great. Like this is a beautiful thing, you guys. This is so great because it cuts your study time way down. I mean, seriously, cuts your study time down so much. Wow. I cannot believe how excited you guys are. Thank you so much. All right. You just finished your pharm class, barely passed. Thank the Lord. Yes. Fabulous. I am glad you passed. Okay, sorry, you guys. Oh, hi, Seesaw. Hello. What are the main meds to know for the NCLEX? Sorry, you guys. I'm trying to scroll up. I lost a lot of comments up there with everyone joining. What are the main meds to know for the NCLEX? So, the NCLEX does not put out a list of, like, here are the meds you gotta know. Really, what they say is, like, this catch-all, like, you gotta know everything. I know, it's not super helpful. But if you're a Nursing SOS member, we have the, it's like 120, I think, we're over 120 medications that we break down for you inside the Nursing SOS membership community. Those are the must-know ones. Okay, so we have our whole medication database inside the community for you that walks you through everything you have to know for those meds. Those are the ones that you are going to see on the NCLEX. All right, so if you're a Nursing SOS member, we got you. If you are not, just definitely get on the wait list because you're not going to want to miss out. You guys, every single time. So it only opens a few times a year. Every single time we close the doors, people say, I missed it, let me in. And I don't want that to happen to you because it happens every single time. So make sure that you get on the wait list, that you join the next time enrollment opens, like first day it opens, because you don't want to miss it. Happens all the time, and I don't like it. It's the worst day. I gotta tell you. The membership community is so amazing, and it also breaks my heart when I see students that like want to get in, but then they can't. But the thing is that when you are in, we are here to literally hold your hand through nursing school. Like if you have a question, submit a tutor form to our team. Like we're here. You can post inside our community forum. You just let us know. You can jump on a coaching call. You can jump on one of our coffee chats. Like we're here. Like, you know me, I show up on live video all the time. So if you guys have any questions, if you're a member, like we are here for you. Also, nursing SS members, I know you know this, but I mentioned it at the beginning, something new that I haven't said before. We have a lot of pharmacology stuff coming for you over the next, I'm going to say like few weeks, even a couple months. We have a lot of pharmacology stuff coming for you that is going to change the game. So great. Like, I can't talk about it now. Matthew hasn't told me I can talk about it yet. And I need to stick to the rules, okay? So, in a few weeks, you will just be so excited, okay? Anita, you're amazing. You were by my side all through nursing school. Love you, friend. I love you too. Yes, our nursing SS members are amazing, and it's so fun because we actually are friends, okay? So, like, when you're a member, like, I know who you are, right? So great. Okay, Caitlin, hello. Is nursing assessment and intervention the same thing? I suppose it depends on who you ask, but no, like ultimately no. The nursing assessment is basically data collection on your patient. So when you are, like Caitlin, think of your head to toe assessment. I mean, that's like everything you collect in your head to toe assessment, your subjective data, your objective data. So with pharmacology, right, when you're giving a medication, let's say, Caitlin, you're giving a blood pressure medication. Your nursing assessment would be to go assess their heart rate, assess their blood pressure right before giving a blood pressure medication, friends. Assess their blood pressure. Okay? We all on board with that? Cool. That's going to help you pass some exams right there. Let me just tell you. Caitlin. So, no, they are not the same thing. Nursing assessment versus nursing intervention. Nursing intervention would be like giving the medication. Okay, so assessing is like assessing their heart rate, assessing their blood pressure. The nursing intervention is actually giving it. Like, the nursing intervention is actually doing something that's like not collecting data, right? So like giving the medication, putting up the IV drip, doing wound care, that would be the intervention, but assessing the wound, like looking at the wound, that would be the assessment part. Does that make sense? Is that clear? Hopefully I was clear on that. Hey, okay, so friends, super exciting. I really want to tell you now because I said it at the beginning and I'm going to repeat it now because it's awesome and we're super excited, okay? So, Matthew and I, so if it's your first time joining, usually I'm not alone. Usually my husband's here and he's awesome. His name is Matthew and you're going to like him. He's usually here on Monday nights. Now, we have done this live nursing school show for many years now, and it is so fun. And so Monday nights just are not working for us because we have several children and they're never in bed together. Like, they're never like, we can never get them to go down at the same time, okay? Those of you with children, you'll understand what I mean. So, the evenings are just not working, okay? So we're switching back to Mondays and Wednesdays. So exciting. So you don't just get us once a week. You'll get us twice a week. But it's going to be in the mornings, okay? So 7 a.m. Pacific, 10 a.m. Eastern, all right? And then whatever other time zone you're in. But those are the time zones, okay? 7 Pacific, 10 Eastern. And Matthew and I are going to be here on live video, and we're going to do it AMA style like we used to. Like, okay, raise your hand. Who was here back when Matthew and I did AMAs and, like, Ask Me Anything style live videos? We kind of switched to topics for a while, and we've been doing topics. Like, tonight's topic is pharmacology, but we used to do Ask Me Anythings. And I just found those so much fun. I think it's really fun when you can just ask me questions about like studying and what to do and all the things. Then I can just answer them in real time. So who's up for that? Cool? Yay? Martha Joe's like, can't tell if is that a crying face? Are you not able to attend in the morning? I'm sorry. Yes, how do you study med surg? See, I would love to answer that on Wednesday at 7 a.m. Pacific. Central time? I don't know what that is, Central time. I don't know. 7 is Central like 1 less than Eastern? That sounds right. So maybe Central's like 9? I don't know. That sounds right. No. Did someone just ask if I was Canadian? No, I'm not Canadian. But that would be cool. I mean, we basically live in Canada, if you were wondering. But we are not Canadian. Only Monday. Okay, I'm glad you're gonna be there. Caitlin, yes, 9 a.m. sounds right. Okay, for Central Time. Thank you. See, time zones, not my strong suit. Helping you pass nursing school, definitely my strong suit. But time zones, not. No. Yes. So, Wednesday, Matthew and I will be live 7 a.m. Pacific, 10 a.m. Eastern. It's going to be 2 days a week, so you get us 2 days a week. Oh, you guys, I'm so excited. Can you feel the vibe? Can you feel the energy? So excited. So bring your questions. It's going to be Ask Me Anything. That is what we're doing. We're going to talk study tips. We're going to talk med-surg. We'll talk critical thinking. Who has a trouble with critical thinking like all of us do in nursing school? We can talk about all of it. So great. Oh, did you just think I was friendly like a Canadian? That is one of the highest compliments. Thank you. We can talk about the NCLEX. Yes, Valencia, Wednesday. Fabulous. Yeah, so Matthew and I will be on Wednesday, 7 a.m. Pacific. We got the time zones, y'all. Okay, 7 a.m. Pacific, 10 Eastern. Fabulous. I'm telling you, time zones, not my best quality. Helping you pass nursing school, that's what I do. I do it really well, but time zones, not my thing. Okay, you guys, we will see you on Wednesday. I'm sorry, I don't know if you can hear the baby crying in the background, but the baby's crying, so I have to go. I will see you on Wednesday, okay? Both on Instagram and on YouTube. So we will try to schedule them out. Matthew will schedule them out on our YouTube channel. I will try to be faithful and schedule them out on Instagram if I remember. If I forget, please somebody DM me, okay? Please someone DM me. Tell me to remember to schedule it on Instagram so that you can add it to your calendar. Cool. And follow me on Instagram stories, okay? Because why not? And those are so much fun. So you guys, I will see you on Wednesday. You're awesome. Thank you so much for all your comments. Sorry, your comments are coming in so fast. I really appreciate it. Yes, we will see you on Wednesday. Bring all your questions. It's going to be great. All right, friends, we'll see you Wednesday. Bye.